Isolite has definitely made our life easier. It's certainly, it's very efficient, it's quick, it's easy. We've actually enjoyed it quite a bit.
I like the lack of moisture that builds up. I like the light that I can see everything perfectly. I like the retraction so nothing's in my way. It's a wonderful system.
Isolite is what allows me to do the best I can. It gives me the access, it gives me the visibility. It has positive retraction for both the tongue and cheek. Suction.
We use it for crown and bridge, we use it for implants, we use it for our seating, our cases.
It shortened the time on procedures. My assistants love Isolite. I love the Isolite. And it's just made dentistry that much better for me.
My name is Dr. Charles Samaras, Pinehurst, North Carolina. I'm a general dentist that does a lot of ceramic restorations, inlays, onlays, veneers, and crowns. Mine is a more moderate volume, service-oriented, striving for clinical excellence practice. I don't know how anybody can see a high volume of patients and provide the kind of clinical excellence and service that patients want and deserve. Therefore, I like a more moderate volume practice and strive for excellence in patient service and comfort, and I utilize all the technology to provide that service. Isolite has made my life much easier because it's made my patient's life much easier. We are, as dentists, we're trained to work in adverse conditions. Anybody that works in a patient's mouth in a very small orifice while they're awake, and if a patient's having some discomfort in terms of patient fatigue and opening their mouths, it makes my life so much easier. The ability to have access, the ability to have visibility, to see what I'm doing, the ability to have total retraction of cheek and tongue, suction, a dry environment. It allows me to prepare better, it allows me to insert better, cement better, and it allows the patient to have a more positive patient experience.
My name is Tina Calloway, and I'm a certified dental assistant. My role in the dental practice is to take care of my patients, to make sure that they're comfortable, and to educate them about their oral health care. Just the other day we actually did, it was just yesterday as a matter of fact, we did an implant case. And those parts are so tiny that you have to make sure that the patient's protected, that no one swallows them. And we went ahead and placed our implant, and it just so happens, sometimes the doctor's fingers are a little bit big, and when you place it in, it doesn't quite go in like you want it, and it may fall to the side of their tongue. And the Isolite was there to catch it. It was fabulous.
My name is Ron Heinen. I'm a dentist, and I've been practicing about 35 years now. My practice is a busy practice. We have 2 dentists in the office. We have over 5 hygienists. I'd say 98% of my patients like Isolite. At first they're a little intimidated, but once they've used the Isolite, I always ask them, would you recommend it to other patients, or would you use it again? And they say definitely.
I consider that we have a busy practice, and we see a whole gamut of patients. I started using Isolite very slowly at first, but it was very user-friendly, so I was able to incorporate it into a lot of different procedures, from sealants with children to complex cases, crowns, bridges. Actually, I wasn't sure how it was going to affect my day-to-day life, but it has made procedures much quicker and easier, and the patients enjoy it as well.
When I first started using Isolite, it was really very simple to implement in our practice. I had previously used rubber dam for most restorative procedures, and I found that it was easier to use. Patients accepted it a lot better, and I could use it for a broader spectrum than you can. Rubber dam is much easier.
Isolite's made my life easier in multiple ways. I'll use an example from myself as just being able to maneuver in a field that is very limited and have complete access without things getting in my way, which is, cheeks and tongues and all things that I don't want getting in the way of myself. But the other thing it's done for me is it keeps my patients quiet, which sometimes it's hard, and it keeps them comfortable. I mean, it's amazing. You get this thing in there that looks pretty large. It goes in, you tell them, just relax a second while I get it down. It pops right in, and then they're just like, is that it? And they're done, and they just sit there and don't move. And I got a TV set above them, so they're just, and it's great, It does, so it helps me and it helps them. It makes 2 people happy. Win-win. I first learned about Isolite as a CEREC user, actually. When I started using CEREC, it sort of went so hand in hand from everyone I had spoke to before me. They said, you got to try it. I put the first one in and it was done from there. I'd never looked back.
I am a brand new dentist and I am just starting out. I found Isolite has made my day a lot easier because it's quicker. You can, get through procedures a lot faster and, saves the patient time and me time.
My name is Dr. Dan Pham. I'm a dentist and I'm the owner of Pham Family Dentistry. Isolite has been perfect for me and I feel like I'm very dependent on it now. I can't live without it.
We definitely get our procedures accomplished more quickly. I would say maybe 15 to 20%. And for crown and bridge, I don't want to do any crown and bridge without my Isolite.
I'd recommend it to anybody that listens. Anybody who wants to have the kind of ability to treat a patient with excellent access, great visibility, suction, retraction, and patient comfort, I'd recommend it to any dentist. In fact, I think it should be part of every single dental office.